How to assess for deterioration. Whenever you start any assessment of a patient, you need to follow a systematic approach. The approach shown in this film will be an A to E assessment. Before starting, assess for danger and wash your hands. Depending on the situation, consider the use of gloves. Mr. Edwards is a 40-year-old man who you are meeting for the first time. He has been a patient on the ward for 6 days. We are now going to take you through an A to E assessment. How to assess an airway. Look at your patient and ask how they are. Depending on how they respond will enable you to assess the patency of their airway. Put your face sideways to the patient if they have not responded to your initial greeting. You should look for obstruction in the airway, chest movements, cyanosis. You should feel for breath on your cheek, and you should listen for breath sounds, stridor, inspiratory, wheezing, expiratory, and gargling. If there is no patient airway, call for help. How to assess breathing. Look at the chest for rate, rhythm, and symmetry over 1 minute. You should look for respiratory distress, use of accessory muscles, cyanosis, gasping, pursed lips and nasal flaring, trachea deviation, noticeable in the neck, sweating, thoracic wounds or scars. You should feel for tracheal deviation, asymmetry in chest expansion, or a change in percussion note. You should listen for asymmetry of breath sounds, added sounds, crepitations in lung bases, and wheezing. You should also measure pulse oximetry and respiratory rate. How to assess circulation. Here you will look at the patient's colour, any visible blood loss, cyanosis, and sweating. You will feel for peripheral perfusion, for example, is the hand cold, peripheral capillary refill, pulse rate, rhythm, strength, and peripheral edema. You should listen for heart sounds and measure heart rate, blood pressure, urine output, and capillary refill time. How to assess disability. Assess their consciousness level by using ACV-PU, their blood glucose level, and assess the patient's temperature. How to assess exposure. A full patient exposure is necessary in order to properly examine the patient. However, you should consider the patient's dignity. If possible, try to get informed consent. Look for signs of trauma, bleeding, skin reactions like rashes, needle marks, or anything else that might be the cause. Body temperature can be estimated by feeling the skin or using a thermometer when available. We are now going to show you how to record a News 2 score. Ensure you record all observations accurately. SBAR is the Trust's approved handover tool. This stands for Situation, Background, Assessment, and Recommendation. The handover for John using SBAR to a doctor would be Situation. Introduce yourself and your position on the ward. We have John Edwards, a 40-year-old male, on the ward currently. Background. He was admitted 6 days ago for rehab. Assessment. I found him today. He has a new score of 10. The patient is rapidly deteriorating. He is newly confused. I have started oxygen. Recommendation. I would like a doctor to review him now. Outcomes following the implementation of SBAR include improved patient safety, increased quality of care, reduced patient falls during shift change, a decreased response time to nurses' request for patients' review, and reduced reporting time by up to 70%.